the patient paid cost, this is also slightly higher cost in Delta. So cost difference is 5,100 yen, and cumulative life percent difference is 9.5%. So from this data, ISA is about 536.84 yen per percent. So how can we evaluate whether this is cost effective or not? So the cumulative life percent difference will vary within 95% confidence intervals. So delta is not always severe. So to address this uncertainty, we create ISA distributions using bootstrap methods. So median ISA is this value and the 95% CI is this range. So when we set willingness to pay at 24,600 yen, the probability that ISA falls below willingness to pay is about 99%. So this is cost effective. So in summary, choice using Follitropin delta is the patient friendly because the dosing is tailored based on the body weight and image and injury in the fixed dose protocol. This is personalized and simplified. And using Follitropin delta, preventing the OHSS and increase cumulative life versus cumulative pregnancy rate, this is effective. And most importantly, this process cost effective. This is patient friendly.